the landscape of public health, humanitarian work, and international policy is shifting, obviously, due to significant political economic changes. And we know that the US federal funding for global health is evolving as USAID has been decimated, affecting international collaborations and opportunities, and a lot of colleagues and friends in this area as well. For those of you who are considering careers in humanitarian response, public health policy, or organizations like the WHO and the Gates Foundation, understanding this dynamic in the moment that we're in becomes super important. I want to mention that today we have PhD students in non-lab-based science programs from Hopkins. We have public health programs, DRPH folks, and some from lab-based groups as well, given Dr. Laura Norris's background. So today what we'll explore is how to break into public health careers and navigating any hiring barriers, the impact on current trends and shifts on job trends, and any skills and strategies needed to build a sustainable career in the field. I will introduce our speakers today and quickly tell you a little bit more about them so we can focus on the Q&A portion. So Dr. Asante Kamuyango has built a career at the intersection of policy, implementation, and crisis response. She has worked across continents from field-based humanitarian roles. I understand, Dr. Asante, you also have a background at JPIGO, which is
Yes, I do.
Okay. And you worked from shaping high-level strategy at WHO Geneva. And your expertise is in contraception, fertility care, health interventions in LMICs, for those who are not familiar, low and middle income countries. And you have a critical perspective on how public health policies translate into real world impact. Dr. Norris, you started your journey with a PhD in molecular microbiology and immunology, similar to my background, from our very own Bloomberg School of Public Health. So welcome back. This was followed by a postdoc at UC Davis focused on malaria and molecular ecology, epidemiology, mosquito population genomics. And you currently manage research endeavors like Gene Drive, mosquito molecular biology and vector genomics and surveillance at the Gates Foundation. And prior to joining the Gates Foundation, you were a science and technology policy fellow at the President's Malaria Initiative at USAID. Okay, today is based on themes. Our first theme is breaking into global health careers. Dr. Norris, we'll start with you. Your career journey obviously took you from Hopkins to malaria molecular research to global health at USAID and Gates Foundation. What motivated this transition, and what advice would you give scholars from all backgrounds looking to pivot from lab-based science to international health careers?
I wish I could say it was some kind of positive force that was driving me, but actually it was wanting to leave academia. I was working in mosquito population genomics. Interestingly, mosquitoes actually make a really good model organism for evolution and speciation. But I was starting to wonder, what is this doing to help anyone? Now looking in retrospect, I'm like, basic science is very important. But at the time, I was like, why am I like banging my head and working so hard on this thing that like isn't really going to actually impact anybody with malaria, at least that I could see. I couldn't see the thread. And I had been in academia for my whole career. I wanted to know what else is going on outside of academia. Are there things that I could be doing that are more impactful than being this tiny lab in this tiny field, only communicating with a small part of the malaria research ecosystem? I was also unsure of like how to proceed in academia. I didn't feel like I was set up well for a faculty position. I was going to have to do, this was actually my second postdoc. I didn't even mention my first postdoc in the bio sketch. I felt like I was going to have to do a third postdoc with a better mentor to even get a faculty position. And so I actually ended up applying for AAAS, the American Academy for the Advancement of Science, does a science and technology policy fellowship where they place PhDs within federal government agencies to work on science policy. I found that really interesting. I knew other colleagues from Hopkins who had done that and really loved the experience and felt that it was very eye-opening and like really gave you a breadth of understanding for how the entire system works in public health. So I applied, obviously got into USAID, and it's honestly, I think it's like fascinating. Now in my current role, I work with a lot of scientists who are like incredibly brilliant, like really smart people in their fields. And then it's so funny, I think sometimes I'll talk about something that I think is like relatively straightforward in like the larger scheme of things. And they're like, wow, fascinating. I had no idea. Not to denigrate academic research. And so I ended up working at USAID for 3 years. I normally, if I'm on a career panel, like I absolutely am always like, do the AAAS fellowship if you can. Currently, I don't know what's going to happen with that. So keep an eye out. And I do want to say, just for everybody out there, I feel like I came into global health at a time where I was really lucky with the situation. When I was starting my PhD, malaria funding was ramping up significantly. That's part of the reason I think why I ended up in malaria. I had a broad interest in infectious diseases, but the amount of funding for malaria really made it obvious that it was like a good choice. And I've been riding that wave. And I understand it's got to be like really uncertain and scary at this point to be trying to break into global health when you're not riding that wave of new funding and interest.
Yeah. Thank you for your honesty. I want to set that tone today. We're just going to be real about where we stand. We're not going to fluff anything up. So appreciate that take. Thank you so much. I'll switch over to Asante. You worked with WHO, Save the Children, healthcare programs in LMICs. Many attendees have asked the question about the experience paradox, which is jobs that require prior field experience, but getting that experience can be challenging. What are some realistic entry points for scholars looking to break into international public health? And you yourself, you work trans continents and you're bringing that international perspective sitting in Geneva at WHO. Can you share a little bit about what were those entry points for you?
Yes, thank you so much, everyone, and thank you for having me. So I think what is most important for me to do is to actually share my story of where I came from and how I came here. So my background, I was born and raised in Malawi, and I studied nursing and midwifery at the University of Malawi. And then after not actually after, but during my studies, I became more interested into the world of public health and working with nonprofits. So during that time when I was a nursing student, I volunteered for different organizations, working with people who are coming maybe to volunteer themselves from the US, from other countries. And I would be on the team doing medical outreach work in different rural areas in Malawi. So that's what I did, like on the weekends or on holidays whilst I was in nursing school. And then after I graduated, during the year that I was waiting for my registration exams to become a registered nurse, I went for an internship. And this internship was with a faith-based organization. And I went to the US to do an internship on young people. And we were in these summer camps and doing counseling, just interacting with the young people in that aspect. And from that experience, that's when I entered into the nonprofit sector. So I was a nurse midwife who traditionally you're supposed to go into the clinical area. But for me, my journey was different. I worked very briefly in the clinical area, less than a year. And then I went straight into nonprofit organizations. And I worked with Family Planning Association of Malawi, which is part of the IPPF, of course, member association of IPPF. And then I went to JPIGO and moved from one NGO to another. And then that's when I decided to go and do further studies. So I went to China, Taiwan, where I actually studied a PhD in public health. And after my PhD is when I got into WHO through what is called the Young Professionals Program. So as you can see from my journey, it already shows you the things that you can do. So volunteer if you can to different NGOs, because if you don't do that, there will be no way you can prove that this is an area of interest or it's a passion for you. So volunteer for different nonprofit organizations working on the subject areas that you're interested in. For me, it was mostly women's health, and that's how I entered into the whole area of international public health. And also I did an internship, which just happened to be in the US. And I think that actually helped me to get my first job, because now now people saw that, okay, she's interested into projects to do with women's health, sexual reproductive health for young people. And that actually came together and brought me to WHO today. So as you can see, this is a long journey that has allowed me to come to WHO. And with WHO, there are different programs for people from low and middle income countries. So one of them is the Young Professional Program, but also if you come from an OECD country like Germany or any other countries in Europe, there is what is called the Junior Professionals Officer. It's another program. And if you apply through that way, then you can come through your government's funding into the UN system. It's not necessarily WHO, but it's the UN system. So for the wider UN system is up to the age of 32, you can join. And for WHO, it's actually age of 35. So be on the lookout for such programs that are really targeting young people who have just started out their career. And I think those kind of programs, they shape you into joining the international public health space as opposed to trying to join through other ways. I think this is one of the best ways.
Okay, thank you for that advice. I wanted to ask, I read your bio in the beginning, but I really want to give and paint a picture to those who may not be familiar. What exactly do you do in your typical week? What does that title mean? And can you paint a picture in maybe 2 minutes, each of you, about what your role actually entails? What can I expect if I shoot for that job that you have? So Laura, we'll start with you and move on to Asante after that.
It's a whole mix of things. So I'm a program officer, which basically means I make and manage research grants, which sometimes can be like very lofty. We're deciding what the research priorities are. We're deciding what the best use of funding is, and then going out and finding partners that can do that work. In other times, it's extremely banal, like reviewing contracts and fixing small corrections and shuffling paperwork around. So it can be a big mix. We work very closely with our grantees. So maybe contrasting with NIH, some of you like working in the labs, you don't have a huge amount of interaction with your program officers with NIH, but we actually are pretty tightly involved with our grantees, particularly because we fund a lot of translational research. And so I work in R&D, research and development. And so we fund a lot of novel products that may be helpful for malaria for malaria implementation. And so I do a lot of work very closely with them to make sure that like things are progressing, that different partners are working well together, that we're looking ahead to what the gaps are and funding those potential gaps in order to make everything work. It can be really interesting at times. Like some of my favorite moments during the work week are having update calls with grantees, particularly like it's so cool to get like the latest results before they've been published or pre-printed or anybody else has seen them. I get to see all of this really interesting research that happens. I also get to deal with a lot of like internal politics and budgets and whatnot. I think I would have to find it. Maybe I can drop it in the chat later, but I think there was like a really interesting article that somebody from the NIH wrote about what is it like to be a program officer, that it's both lofty and that you have all of this power over the funding landscape, but also a little like thankless and not super glorious, and like what kind of person makes a good program officer. So I'll see if I can find that really quick while Dr. Asante is talking. I'll drop it in the chat.
Okay, thank you. Asante?
Yes, thank you so much. My work, actually, I work in research in WHO. Maybe just to introduce a little bit of my department. My department is called Human Reproduction Program, and this is a special program that is hosted by WHO, but also it includes other UN agencies that come together to form this program. And what we do, for the most part, is we do research in sexual reproductive health, so different areas of sexual reproductive health, but also the arm of our work is also with WHO as a department for sexual reproductive health. And in that department, we actually do produce guidelines to do with different aspects of sexual reproductive health, whether it's abortion, maternal and health, maternal health, and in my specific role, I do contraception and fertility care. So in my role at the moment, for example, just to give you a typical day, my typical day is that we are preparing for a new guideline that is going to be in this subject area. And how we do that is by synthesizing evidence. So we have different teams that are working on different systematic reviews. So my role is actually overseeing all that work to make sure that all the people who are working on systematic reviews, following the right procedures, and to coordinate with the methodologists, and also to come up with the rating of the evidence, which we use definitely GRED to see the strength of evidence in that particular aspect. So then at the end of the day, we do have guideline review committee and also the guideline development groups that come together and do come up with recommendations. And in the end, we have a WHO guideline. So my work includes, of course, the evidence synthesis, but also another aspect of my work is to work with different teams in countries who are working on implementation research, on different research programs on sexual and reproductive health. And we work with them to create the proposals, to come up with the results, and also just working together to make sure that the research is being done according to the plan. I'm very blessed to be in this role because I'm able to see how research actually moves to policy and how it actually happens, because I'm like in that little link where that actually happens. I think in brief, I can explain it that way, and maybe if others have more questions that they would like to ask to be specific, then feel free to ask. Thank you.
Yes. For the audience, anytime you have any question, drop it in the chat box. I'll incorporate it at the right time. And we'll have a moment where you can also unmute and ask as well. I want this conversation to be super casual. I know the audience, sort of, Michelle, you asked about skills. We're going to get there in a second. And so that's a good segue into actually navigating careers in your organization. So Asante, WHO is one of the most competitive institutions in global health to get into. What sets successful applicants apart, and what advice would you give PhD, DRPH folks hoping to work at WHO when it comes to applications and entry points in terms of skill sets?
Okay. So I think the most important thing about working for an international organization is someone who is more adaptable as a person. So I think your personality also plays a big role in the kind of work that we do, because our work involves working with people from different cultures, different backgrounds, and being open-minded and being adaptable is one of the most important aspects of our work. And actually, your communication skills, whether you're able to communicate with different people from different backgrounds, and also, I think one aspect for the work itself, you require, of course, scientific rigor, which all of us have, but what is important is your project management skills, because it can be a lot of work. There's a lot of moving parts and so many people doing different things. And for you to be able to deliver well, you need to have transferable skills. Your organization skills are going to come very handy. Your project management skills are going to come in very handy. And I think that for most people, when you work in an international organization such as WHO, the way that you're able to prioritize work and to know what is important to be done and what is supposed to be done in this moment is actually more important, because there's just so much work to do, but you have to be able to choose what is the most important at that moment and to actually sequence it properly. But also your ability to work with others. Teamwork is very important. So all these things, they come first of all through your application process. So as you're applying for WHO or another international organization in the UN system, we have, of course, your profile in the UN, and it's not, you don't just give a CV, but you have to develop a profile. And in that profile, I really recommend that you show your achievements. So not only your job description, but you actually have to articulate how you're able to use your skills. So for example, you can say, okay, when I was working with this organization, this is what I did, and really showing your achievements in the field is actually important so that you make a successful match with the person that is actually trying to look for the right CVs for the different positions. And also another thing when you're preparing for the interview, to think about how your previous work matches with the vision and the mission of WHO. So if WHO's work really aligns with what you've done before, when you come into the interview, make sure you show that thread. And also in the interview, to come in calm and to show that you're willing to work with others from different backgrounds, showing your level of teamwork is actually very important. So in a nutshell, I think that as you prepare for your next career, and if you really want to work in international development, you don't need to start just at the application process, but you need to start already thinking about yourself, self-reflection. Try to really be introspective and look at your skills, look at your personality, and then move on into applying for different jobs.
Beautifully said. Thank you so much. Laura, would you agree? Mainly, I want to ask Michelle's question. What does it take to be a successful applicant for a program officer role? What skills should I focus on?
Yeah, I would echo everything that Dr. Asante said. The number of people that I have to work with and coordinate with that I don't have any direct authority over is large, both within the Gates Foundation, other people on the malaria team, regulatory team, policy and advocacy team, et cetera, as well as outside of the foundation with grantees that we work with, other international organizations we work with like WHO and USAID and others. Just like you said, the adaptability, the ability to communicate with different people. And also that our grantees include both those in high income countries, but we have an increasing focus on trying to fund grantees based in low and middle income countries, which can have very different circumstances. So absolutely that like adaptability and communication. And I would also add negotiation, which was something my boss actually was like, I think you need to take a negotiation training, which I had always thought of as hard driving businessmen and like mergers and acquisitions, but it was actually like incredibly helpful. The trainer that I took it from, I think she's at Harvard and was actually part of the negotiation team between Israel and Palestine in one of the previous ceasefires years ago. And the focus was really on like, how do you work together to get to something that is helpful for both people? That we shouldn't be trying to see it as like a win-lose or like we're all in global health together. The goal is like, how do we meet all of our own priorities and advance the field together? So absolutely negotiation is one. I would also add for the Gates Foundation in particular, having like hard skills and a particular niche is really helpful. None of us can do all of global health on our own. Like I mentioned, my background is in like field biology and molecular biology of mosquitoes, but I work with people who previously worked at FDA or in other regulatory systems. I work with people who came from industry, biostatisticians, and people working on like, how do you design clinical research trials? So I think having that niche is incredibly helpful because otherwise you're just showing up as one of many people who have an MPH or a vague international health background. But if you can show that this is the one thing I really excel at that nobody else does, that's incredibly helpful.
Great advice. Thank you. Very practical too. Laura, I have a question for you since you have the mic. Many global health careers are tied to funding cycles. You've seen it with USAID, also Gates Foundation, Global Fund. How do job seekers prepare for the instability that comes with grant-based hiring? If you have any perspective on that.
Yeah. It's interesting because my answer has been I've avoided it. I left academia. I know a lot of our grantees some have permanent positions, but some are on a grant-based position where if there isn't a renewal, they will not get that job continued.
Yeah.
So I personally, because I prefer to be a little bit more stable, I want to stay in Maryland. My partner is a psychotherapist. He is licensed in Maryland. I don't want to be moving around a lot. So I have tried to choose jobs where it's a little bit more permanent. But some people really thrive on moving from position to position. You get so much more exposure to different organizations and different parts of the ecosystem doing that. I do think I won't make predictions about the future, but historically, living in the DC area has been actually really great for being able to move between different organizations working on international health. There are a lot that have DC offices. So I think being aware of it is really just like that's the most you can do. Being aware and then being open to what are the other opportunities for your next move.
Yeah. Okay. Thank you. And for you, Asante, we know that NGOs such as Save the Children, MSA, MSF, PIH implement programs, but often face funding constraints and political pressures. For those considering those paths, what should they weigh when deciding between large global institutions, let's say WHO, and a smaller NGO? How do you make that decision?
I think that it's not easy to make a decision between the two. A lot of people that ended up working with WHO have also worked with other smaller organizations. So I think that when you enter international health as a career path, there are things that you need to be ready in general, whether you're working with a smaller or a larger organization. With a smaller organization, it's good because you can feel your influence right away. So when I worked in Malawi with the local organizations that I worked with, even when I worked with Save the Children, we were implementing projects right there in the community, and I lived close to the community. So you can feel your impact easier. And I think that when you come from that place of knowing what your impact can do, then when you move on to work with a big organization, maybe come to Geneva, then you don't feel so bad because you know that your work is making a difference. You understand what I mean? You don't feel like you're so detached from the world because you're coming from there. You already know. So a lot of people really come from field work and then they transition into international public health. Usually it's like that. But of course, there are always exceptions to the rule. So my perspective is that if you choose international public health, you have to accept that your life might be unstable because also you're moving from one country to another. And the more you move from one country to another, the more experience you're getting. So actually you become a very good international public health practitioner if your path has been moving from one place to another, because you understand the experiences of people from different places, as opposed to if you just stay in one place. So if you are adventurous, then this is the best profession for you. If you are an adventurous person, if you work within the UN system, usually you move every few years, going from one place to another. Your kids will be in school and then they have to move to a different school. It's really part of the work, but it's also fulfilling. It can be seen as a challenge depending on yourself. So depending on your situation, it can seem as a challenge. But if you're adventurous, maybe this is actually a path that you would want. You want to work from one place to another. So I think that's what I'm gonna say. It depends on you.
Okay.
Really.
Makes sense to me. Let me pause a little bit and see if the audience attendees have any questions. Again, you can put in the chat, but also feel free to unmute. So I'll pause for just a few seconds to give you that chance. Hey, don't feel shy. Put it in the chat box if you feel shy to be on the spot. I do want to talk a little bit about the push to shift power from Western-led global health orgs to regional and local leaders in LMICs. And Asante, let me start with you and then I'll switch to Laura with the next question. How is the global health field changing to give more leadership to professionals from LMICs rather than Western-led decision making? And we're talking about decolonizing public health, basically.
Yeah. I think that there have been efforts to really decolonize public health and to decolonize the thinking around public health. I think that what remains also is actually the decolonization itself, the movement to actually be decolonized, because sometimes you can see that it's actually being led by people from the North, this conversation, as opposed to being led by people from the South. So I think that as a field, global health is doing its best to be decolonized, to give more opportunities to people from MIC, the scientists from there, to actually do their own research, to publish their own results. Before, it seemed like there were more of subjects as opposed to researchers as well. But this is actually changing. Given an example, I am one of the people before in WHO, you wouldn't meet someone as young as me coming from a low and middle income country. But that has changed, and I'm in the first program for young professionals program from LMIC. So you can see that in itself is actually a change. And I think that as time goes by, and as maybe Lola can say more about this, even the funders, people who are funding, they are prioritizing funding institutions from low and middle income countries. And I think that with capacity building, enough capacity building, it's important that the people who are working on specific programs must be people who understand how those programs actually work on the ground and understand the cultural and different, because if you're coming from another culture, you don't really understand the challenges. So it's very important for us as people working in global health to trust the local people, that they can actually implement their own programs and they know what they need. And I think that's what is also important, especially for like donors or people from other developed countries trying to help. Sometimes there's this feeling that we know what people need, but actually to be respectful and to say, what do you need? And what can we do to help you? I think is very important. So the conversation for decolonization, I'm very passionate about it. And I think it's really an important change. And I'm glad that we are moving this way.
Okay, thank you for sharing. And I asked that because of the decision. You said it's up to you, and a lot of times we're factoring in our value system, so people will want to know what's happening on the other end. And so, Laura, I was wondering if you could speak to Kimberly's question in the chat. Can you speak about any consultancies, short or long term, as a pathway to working with and partnering with WHO or USAID?
That's a good question. In my experience, and it's obviously relatively limited, a lot of consultants are generally, they've been in the career longer. And people know, oh, this person has this experience. We've worked with them before. We can go to them for a short-term consultancy. I'm trying to think about the people that I know at USAID. A lot of them came in through working with various implementing partners. So for example, Japaigo is one, groups like Kamuyango, Aptos, like all of these Beltway bandits, basically. They either came in through that, or USAID has a lot of Foreign Service nationals based at all of their missions that are local staff that work with USAID. I'm trying to think if there are specific examples of consultancies, but I think it tends to be more like a short-term position with an implementing partner rather than like an independent consultant.
Asante, is anything to add to that from your perspective?
Yes, within WHO, indeed, they used to be, or there's still people who work as consultants. At the moment, because of the funding, there isn't new hires being done. But this is the situation is evolving. So a lot of things might change. A year from now, you might actually not even be worrying about the things we are worrying about now. So just to say that this is really a temporary thing, and we shouldn't think that global health as a field, it's over, it's done. I don't think so. I think there is no way it can be done because it is such an important aspect of human existence, and there will always be a room for global health. And so in terms of careers, yes, you can start as a consultant. There are many consultancies that open up, and there is actually something called a roster. So if you ever see the word roster, it means that you can apply for a position, but it doesn't mean that the position is already available then, but then you are put on a list of names. And when something similar that fits your experience comes up, you're actually contacted by the technical officer responsible for that, and then you can go through the process to actually get the job. So there are different ways that you can enter the system. Like I said, through the Young Professionals Program, Junior Professionals Program. You can also enter through fellowship. WHO has internships as well, that any person, it doesn't have an age limit. Anyone can enter as an intern. So you can also apply as an intern. And as a consultant, of course, when there is a call for consultancy that fits your skills, apply. And if it says roster, apply too, because even though they don't give you the job right then, right now, but usually people within the next 3 years, you get a position. Once you're in the system, I've seen in the chat, someone is asking about the difference between temporary and fixed term staff. So temporary positions are based on maybe funding that is available for just a limited amount of time, or it's a position that usually it's like that, it's based on funding. Fixed term position, then it means that it's more of a long-term thing. What I can say about life is you have to allow yourself to go through the system first. I think if you come with the mindset of thinking that you want to enter only through a fixed term, that's the only way you accept a position, then it will be very difficult. But you have to take all the opportunities that are given to you. So whether it's a consultancy, take it. Whether it's a staff position, take it. Whether it's temporary or fixed term, take it. Because you know what that does? It puts you into the system, right? You now know people, you now know how the system works, and you're not wasting your time not working. You're still working on something that you're passionate about. And as years go by, whether you move into that fixed term position that is COVID, it's your luck, that can happen too. So I think that just be more open-minded and be adaptable. That's the only way to make it in international health in general.
Yeah, I would absolutely agree. I started at the Gates Foundation as a 1-year LTE, which is our kind of equivalent of I think it's a limited term position. And I continued on year-to-year contracts for, I think, over 3 years before I was finally made a full-time employee. I've now been there over 7 years, but it was at the time I was leaving like a relatively stable job at USAID. The Trump administration had just started the last time around, but I had a relatively stable job, but I was really interested in this one. And so it was a bit of a risk that I could have just been there for a year and then left, but I would have gotten the experience of working at the Gates Foundation for that year.
Okay, that answers that question. I do have a question on behalf of international students and folks with different kinds of visas. There's always this attached anxiety. You may or may not know this, but what workarounds or strategies have you seen, maybe with colleagues or yourself, where you've seen folks navigate these challenges being international? And I think there's a question in the chat and it answers that as well. Anybody can go, whoever has experience with this.
Oh, it's definitely harder. I'm a US citizen, so that I'm lucky in that respect. I do know a lot of other colleagues who are on visas. I've heard like one of my colleagues was telling me this horror story. He's based in Seattle. He went to Vancouver for the weekend and something happened with the administration and he couldn't get back to Seattle for over a month. Luckily, like the foundation was very supportive of like mailing him a laptop, like getting him a place to stay. But yeah, just I think being well connected, particularly being well connected with other people that are on visas to like share experiences and resources tends to be the most helpful.
But you do see folks with different visas working with you at the foundation. Okay.
Yeah. And I will say, actually, we have like the malaria team has geographically expanded quite a bit over the last several years. So when I joined, I was the only person not based in Seattle.
Mm.
At this point, we have several people that are remote in the US, in London, and now several people based in Africa. And so a lot of them they're not based in the country they're from. We have one person from Nigeria based in Kenya. So like for the right person, they're willing to like make things work in terms of visas and work permits.
Okay. Asante, any perspective from your end? Yours is a completely different perspective because you are in Switzerland.
Yes, that's true. But also, I am from Malawi. So, of course, I don't have the advantage of having a visa, a passport that's easier to go any place. But I think that what I have noticed is it gets easier over time. So, I think the first time that I applied for my US visa, I hadn't been outside of Malawi. And it was a nerve-wracking experience because they really want to know what are you going to do here. But it always helps because as long as your job gives you a supporting letter, it's easier for you to get a visa either to come to Europe or to go to the US. So in my case, when I first traveled outside of Malawi, I was going for an internship. And the place that I was the place that I was going to work, they gave me the letter. So it was helpful to go through the process. But of course, it doesn't mean that they pay for you. So that's also money that you have to think about. So maybe just always trying to save a little bit of money so that when maybe an opportunity comes where the organization says, yes, we'll give you a supporting letter, but we won't pay for your visa. And that is very common. So if you're applying for international jobs, if you're working locally in your own country, try to save a little bit of money so that when the opportunity comes, you don't lose it. So like when I was going to school, I had a scholarship, but I didn't have the funding for visa or the funding for the flights. So those are things that you should think about as you're taking jobs from outside of your own country. You might not get the full funding that you expect, especially upfront. So being able to sacrifice a little bit of money that is personal, in the long term, it all cancels out because now you have this job and it gives you your opportunity and your future experience as well. Yeah.
Can I just take a pause and say, what a brilliant panel. Like both of you are, dropping gold nuggets everywhere for everyone to lap up. I'm so excited and so happy. We have such a diverse perspective from where y'all are sitting right now. I appreciate that. So attendees, when I send out the survey later and a copy of the takeaways, please fill out the survey so that we can like show off how amazing these panelists are. So thank you. In the beginning, you talked about transferable skills and what makes a good person in public health: adaptability, flexibility, project management. I think let's go back to a little bit of the practical and tangible tools because that's what folks are asking in the chat as well. So you're about to apply for a position, a program officer, you're putting in a profile in the UN-based system. What are things that I must share on my CV and my resume that will help me stand out from the hundreds of folks that are applying? One. And then two, you're at the interview. What did you do during your interviews that helped you land that job? So Laura, we'll start with you.
Sure. I think there's a few things. Multilingualism is like a huge one. Like I see so many, at least in the past, hopefully things will continue to go forward with global health funding, but like positions where they're looking for a Francophone applicant are always, if you speak French, it'll be a lot easier for you. That makes you stand out from all of the people who don't. And particularly in the malaria field, half of Africa is Francophone. I think experience working in other countries. I know one thing that stood out apparently when I applied for my job was I've never lived outside of the US, but I'd done long stints of field research in Zambia, Zimbabwe, and Tanzania. And so just having that experience apparently made me stand out. And then I think having particular, like I said earlier, like particular skills. One thing that I was talking to my boss yesterday and I was like, what am I going to tell people on this career panel tomorrow? And she was like, tell them to go to industry. Tell them it doesn't have to be just global health. She actually did her PhD also in mosquito biology and epidemiology. She then went to industry and worked in research and development for a long time, became the head of R&D at her company, then came back to like more of the nonprofit sector. And I know a lot of people at the Gates Foundation who have done that, who've worked in drug development, vaccine development, other, not always even in infectious diseases. Maybe they've worked in cancer or other diseases. But bringing those hard skills can be really beneficial for showing that I can bring this to the field of global health. I think another one, biostatistics and data science, like that's one where, and also bioinformatics. I have a smattering of bioinformatics skills, but when I see the number of bioinformatician positions that are open, and I'm like, I wish I had focused more on that in the past.
Yeah.
That's helpful to the folks on the chat who introduced themselves saying they had biostatistics skills. And Sante, Ashley asks, any examples of achievements that might look good on a resume would be super helpful.
Okay, that's great. Of course, they will ask you about your publications.
Mm.
You need to publish. They always say publish or perish in academia, right? But I've also seen that if you're working in, for example, in WHO, where it's also academia adjacent kind of field where we're looking at evidence and synthesizing it and coming up with guidelines, it actually helps if you've published before. So I really encourage you when you, as a PhD student, I don't know if it is part of your requirements to publish before you graduate, but you really have to publish. At least publish as many papers as you can. Anything that you can publish will be great. So share your publications and hopefully they are also in the field that you're applying for. So for example, if they tell you they are looking for a technical officer in maternal health, and if you have papers that have published, I don't know, factors associated with antenatal care in Delhi, that will stand out. Already your profile is signaling that you're an expert in this field. And also when you're looking at your CV, make sure that you optimize the keywords. So if you have a job description, it usually has things that say essential, right? And that essential part, they usually put it in what is called job-specific questions. So if you've ever applied for WHO, you have your profile, you fill in your background and everything. And then the second part, they ask you job-specific questions. There's general questions that are just like, oh, are you willing to travel around and stuff like that? You say yes. And then there are job-specific questions. And on job-specific questions, sometimes they ask you to even write, so what is your motivation for applying for this role? Make sure that on the essential skills, when they're asking you, they usually ask, do you have experience in program management? Tick. Do you have experience, 4+ years experience in this? Tick. Because when it is, for example, a P4 position, they want someone who has experience for more than 5 years. If you have experience for less than 5 years in that specific field, it's not, your application doesn't go at all. Nobody's gonna see it because the system is already calculating. If you have, for example, you're applying for a job that has to do with research, right? And the keywords say something, research, analytics, program analytics. What you're going to do is, from the first job that you've written, from the first job that you've entered in, I worked with such company from 2012 to this year. Make sure the little box where they ask you to put the specific things you've done for that job, you already put your research and analytics skills, because it is counting from that job to your most recent job. Yep. So you have to ensure that you've put in throughout your work experience, you've put in the keywords that are required for that job. Because if you don't put in the keywords, or even if you put the keywords, but you put them only in your latest job that you've just had. It means the years will only count 2 years of this job that you've done, right? So you have to start from the beginning, showing that I really have 5 years or I really have 10 years of this kind of experience. So those are just little things that you can think about, because it is a system, and sometimes the system can boot you out before a real person gets to see. So when you're applying, always think about the keywords that are related to your particular job. And also, when they ask you job-specific questions, make sure you answer yes if it's indeed true, right? So you answer yes, you say, yes, I have done this. Yes, I have done this. Yes, I've worked in a low and middle income country. That is a very common question. Yes, I have worked in, what do you say, an international organization. Yes, I have experience in program management. Yes, I have experience in emergencies. So those are things that I think are important for you to consider when you're applying for jobs.
Awesome. Thank you. Oh, I'm echoing. I was going to wrap up with one question from each of you, maybe less than 30 seconds. What is one career mindset or strategy that has been the most valuable to you in international health that we haven't covered so far? So Laura and then Asante.
Oh, I think trying to stay curious and open. I think we didn't get to some of the questions about how do you sustain yourself over time, but I think being curious and open and acknowledging the small wins as you're going, because it's a slog. I work in R&D. Sometimes you're working on product development that might take 20 years. Are you seeing any impact whatsoever? But staying curious about those small things and the little achievements that we do along the way, I think is really helpful.
Okay, wonderful. And Asante?
For me, I would say stay adaptable and also continue to learn. Learning does not stop when you finish your PhD. I've learned a lot through my journey here at WHO. Even when I entered, there's just so many things that you're going to learn in the organization itself when you get in. So it's important for you to stay open to learning. And also, even when you're working with colleagues, to show that you're someone who is teachable and someone who can truly learn as you go. It's very important for you to keep an open mind and not to already think, oh, I'm an expert, I have a PhD in this, and this is what I know. I was very lucky. I see someone in the chat has asked about their publications, that their publications are very diverse. So they have published in emergency medicine, tobacco cessation. My question is, out of those publications, which ones are you the first author of? Because that is very important. So when you are a first author of something, usually it's a field that you're specifically interested in or an expert in. If you look at my profile publications, most of them have to do with contraception because it's a field that I've been interested in, and it's a field that has shaped my career from the beginning up until now. So I think what is important is those studies that you're publishing, but as first author, will be most important to determine which kind of specific niche that you can look for. And really, apart from being adaptable and also continuous learning, it's important for you to really pick a field in global health that you're passionate about. Because if you have something that you're passionate about, then it's very easy to stay consistent. Even when times get hard, as it is right now, I think when some of you, I hope you follow me on LinkedIn and we can keep the communication going. But a few weeks ago, I posted about these uncertain times. How do you keep going? Because it's been such a difficult time. And sometimes even as you're applying for jobs, you can feel discouraged by how do you keep going? You have to choose a topic, you have to choose something that you're passionate about. And if you're passionate about a specific niche in global health, then that will keep you going. When times get hard, even when you feel like you miss your family, you're working in a remote area, far away from everyone, you are in an emergency, in a certain place where maybe it's not easy to keep going. Your passion for your work will keep you going if you have a specific niche and you have reasons to why you chose it. So that's my encouragement to you.